And that's a moving target right now because there is no single bill. There's a lot of discussion going on at the federal level. We have to make sure that it is cost effective, whatever we do, because we cannot keep transferring debt to our children and our grandchildren, maybe our great-grandchildren at the level we're going. And the last part of this equation of cost and access is quality. How do we ensure that our system is delivering the best quality at the least cost? That's the equation we have to figure out, because in our nation, when we compare ourselves to other nations, we are ranked by World Health Organization in health metrics. That is maternal child mortality, life expectancy, things like that. We're ranked between about 25th and 35th or 40 in the world. Yet we spend... more than any other nation. So the issue has to be, we have to deal with cost and quality and access, and you deserve the best quality for your tax dollars that are being spent on health care. Those are the demands that we have to make on our elected officials. In closing, ladies and gentlemen, I've been around the country with many of our elected officials. I've watched the debates, and I am hurt at how rapidly they degrade into shouting matches. Let us why don't we, as the citizens of Southern Arizona, set an example for the rest of the nation on how this should be done. Thank you very much.
Thank you, Dr. Cremona, and words that set the stage for us tonight. As you came in, everyone was given a ticket with a number. And if you are interested in speaking, we have that ticket up here in the fishbowl. If you want to speak and do not have a ticket, raise your hand and the staff will get around to you and give you a ticket now and bring it up here. We'll put the tickets in the glass tank. When your number is called, please come to the front of the hall and come rather quickly. I'll call probably 3 or 4 in a row, and we'll keep the flow of people coming to ask the question steady and keep it moving. I ask that you limit your comments to fewer than 3 minutes and watch for the lights on the stage to see when your time is up. I get the feeling that the vast majority of us would want to see a civil and a respectful discussion tonight. Therefore, we're ready to move on. And at this point, I will introduce the Congresswoman from District 8, Congresswoman Gabriel Giffords.
Good evening, everyone. Thank you, Mr. Mayor, for having us here in your community, and to all of our community leaders for being here. Yes, the United States Congress is discussing health insurance reform, but it's a problem that doesn't just solely affect the federal government. It affects our county government, our state government, our local government, our business community, private sector as well. And that's why I'm so pleased to be joined by so many members of this outstanding community. Thank you, Dr. Carmona. Dr. Carmona comes at healthcare in a very unique way. We're blessed to have him in Southern Arizona. Non-political, non-partisan, straight shooter, a really good We're going to start calling some names. of very quick comments. I'm not here to defend any piece of legislation. There are currently about 12 bills circulating in the House and Senate. I'm not a sponsor of any of those bills. I have not supported any of those bills. I do not sit on any of the 3 jurisdictions, the committees of jurisdiction that have written any of the bills. Now, I know most of the talk that we've heard about is H.R. 3200. I have read H.R. 3200, it's right here, just as I've read many of the other bills in the House and Senate and many of the analysis. So go ahead, if you want to ask me questions about it, I will do my best to try to discuss it. But really, tonight is about you, your questions, your comments, your concerns, so that when we go back to Washington next week, I can bring your perspectives from Southern Arizona and Cochise County. So with that, Mr. Mayor, let's have people start coming up. We're going to do this in the most transparent way that we know how, and looking forward to hearing your questions and comments.